So we can go ahead and get started. It's a little bit after 12, and so we'll consider this meeting of the Governor's Health Workforce Council meeting started here. First off, I want to say thank you to every person on the call and all the work that you put in between the meetings, all the information that's been provided. Also, I want to thank you for the patience that you've had with us over the last few meetings as we try to make sure that we're perfecting our virtual meetings. If you recall, this time last year, we were trying to figure things out and whether or not we were going to have in-person or virtual meetings, and we've come a long way. So I want to thank you all for your patience. Just a couple of reminders here, more so of housekeeping. Council members are able to mute or unmute yourselves at your discretion. The meeting is being recorded and is viewable live, so I wanted to make sure that you're aware of that. And again, if you have any questions or anything like that that you want to put into the chat, feel free to do that as well. So now we'll move on to our approval of the minutes. I think you received meeting minutes via email in advance of the meeting, and I'd like to see if we have a motion for the approval of those minutes.
So moved, Ken Sauer.
Mud, room, door.
Thank you, Dr. Sauer. Do we have a second?
I'll second Steve Balco.
Okay. All right, all in favor of the motion? Say aye.
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 All opposed, nay. So the motion carried, and the minutes from the meeting of May 25th have been approved. So we do have quite a few things on the agenda. It's a pretty robust agenda. And what I'm going to do now is I'm going to turn it over to Dr. Hannah Maxey to talk about some of the updates on the Indiana Health Workforce Initiatives and to help move us forward in the agenda. So Dr. Maxey.
Thank you so much, Commissioner Payne. I am delighted to walk us through a conversation regarding the license renewal supplemental surveys. That's first up on the agenda today. And just wanted to level set us with a reminder about these supplemental questions that are administered to licensed health professionals in the state of Indiana. Senate Enrolled Act 223 from 2018 requires that individuals licensed by a number of boards in the state of Indiana provide certain specified information at the time of their license renewal. And the purpose of this statute is to collect data that are needed to support healthcare, workforce planning, and health systems evaluation and planning for the state of Indiana. So on the screen, there's just a list. These are the specific professions and their boards that fall under Senate Enrolled Act 223. Just a quick reminder on the role that the council plays, and then specifically, I'd like to just briefly highlight the role then that my team at the Bowen Center plays. The Governor's Health Workforce Council is serving as a review and approval entity for the supplemental questions that are administered as a part of the license renewal process under Senate Enrolled Act 223 from 2018. And I wanted to just very quickly overview the process for you all so that you know what goes on kind of behind the scenes before we actually talk about reviewing and approving some of the actual supplemental questions. The Bowen Center, as many of you are familiar, produces data reports, technical reports, and briefs on licensed health professions in the state of Indiana. During the interim between license renewal periods, the Bowen Center convenes data advisory groups for each board or profession. Those are representative of licensees themselves, employers that typically employ those professionals in their facilities or their organizations. Those advisory group meetings provide opportunity for public or stakeholder input that we then review and bring forward to the council. So when the council is reviewing any proposed modifications, updates, or changes to the supplemental survey questions, those may be from the advisory groups, and we're going to talk specifically about feedback from the Behavioral Health Workforce Data Advisory Group, or they may be generated by council members themselves or state government entities that have interest in seeking modifications to the questions. Just wanted to make sure we were all on the same page with that. After the supplemental questions are reviewed and approved by the council, they're submitted to the PLA. The Bowen Center works with the PLA for the PLA to input those into the license renewal program. And then we work on testing those survey questions to ensure that they are appropriately coded and will be ready for licensees to be seamless when they renew. Some of the values to the surveys that over the last several years have been discussed, both from the perspective of the PLA, from the perspective of the council, but also from the perspective of the professionals themselves, is minimizing the length of the survey wherever possible. We want to reduce burden on licensees and only collect that information that is critical and will be important to supporting policy and planning in the state of Indiana. Minimizing the amount of free text. So wherever there's an option for somebody to click the response and it can be categorized, every attempt is made to categorize that to make it simplified for our licensees in the state. And then the third and final and very important is minimizing any major changes to those questions. When we ask questions over multiple biennia, where we're at now, we have trends. We have data that we can look back, see where we've been, for example, with the count of certain types of physicians or nurses working in certain environments. Modifications to certain questions can threaten Indiana's ability to monitor any trends in our workforce. So minimizing changes is also a value. Are there any high-level questions regarding the supplemental survey tools, how they're developed, what the role of the council is, or what the role of the Bowen Center is?
Yeah, Hannah, this is Ed Charbonneau. Is it okay if I just unmuted myself? And this is the third year now we've done it. If it came in 2018, okay. And what is the how many are complying with it? I guess is it being used?
It is being used. So part of Senate Enrolled Act 223 from 2018 was it authorized the PLA to collect this data. And it actually requires licensees that complete the online renewal process to provide the information. So among online license renewals, there is 100% participation, Senator Charbonneau. So Indiana has, across the states, we have the most comprehensive data on our licensed health professions that is supplemental, if that makes sense. So we license medical doctors. We don't license a pediatrician or a family doctor. They're licensed as a medical doctor in the state of Indiana. For the state to actually get their hands around and understand where all of those specialists are and how many of them we have, that's what the supplemental information collects. And I'm actually going to share with you all in just a few minutes the most recent versions of those data and how they are going to be made much more accessible in the future. Thank you for that question, Senator Charbonneau.
Thank you.
Are there any other questions regarding the supplemental survey tools?
Hannah, just a point of clarification. You said there's 100% participation for everyone who does this online. How many do it online? How many complete the surveys online?
It varies by profession, but it has rapidly moved to, above 90%, with certain professions being approaching 100% of the web-based renewal process. So, but as I said, it does vary by profession. And we do see that there are professions where certain individuals continue to do the manual or paper renewal process. But it's definitely been phasing out over the last several years that I've been overseeing data initiatives. But thank you for that question. And actually, I'll be able to show where you will be able to track that moving into the future too. Does anyone else have any other questions regarding the supplemental questions administered at time of license renewal? Excellent. Hearing none, we are going to go into then the first order of business that is in regards to demographic questions or demographic information, supplemental demographic information that is collected at the time of license renewal from licensed health professionals as part of those supplemental questions. And to give you a little bit of background, I indicated that the Bowen Center convenes workforce data advisory groups for each profession for whom data are collected and reported under our contract, the Bowen Center's contract with the state of Indiana. And so this spring, we convened the Indiana Behavioral Health Workforce Advisory Group. We're happy to provide information on who is on the advisory group. I believe it's available on the Bowen Portal website that we maintain for transparency purposes around reporting. But it is representative of individual professions licensed by the Behavioral Health and Human Services Board, as well as it has input from the Psychology Licensing Board and psychology professionals, in addition to the Behavioral Health and Human Services Board. Our behavioral health data advisory group for the workforce in Indiana identified in the spring that there may be potential opportunities to enhance diversity, equity, and inclusion in the way in which Indiana collects and reports supplemental demographic information. You should have all received a very short brief that the Bowen Center prepared, which summarizes the input and the feedback of this Behavioral Health Workforce Advisory Group in regards to the demographic questions. And I would, if you have it, I would encourage you to open it, but I am also going to share it here on the screen so that you all can see it. Okay. So you should have all received with your meeting reminder a document that was promoting inclusion with health workforce data collection. That brief summarizes the conversation from the Behavioral Health Workforce Data Advisory Group and the conversations that were had regarding the demographic questions. And it also provides a side-by-side comparison of the way in which demographic data are collected across various different entities at the federal level, and then also, of course, the federal minimum data set survey tools for health professionals that the Department of Health and Human Services promotes to states to gather consistent data across the state. So if you're on with us, I'm sharing screen right now for the side-by-side table that our team put together to show, what are the different types of questions and response options that are asked. So a summary of the discussion that was had in the Behavioral Health Workforce Data Advisory Group was around, are there opportunities to enhance inclusion? And specifically, the question was asked, why is white listed first on the option for race? And that our team, serving as the technical expertise for health workforce data collection, I had to frankly say that I needed to look into why white was indicated first, and we did research on that. Indiana implemented with modifications for our state as appropriate the federal minimum data set survey tools for licensed health professionals. And so our response options to the race question simply reflected those that were in the federal minimum data set survey tool. And so that's what you're looking at on the left-hand side of my screen, or if you're in the document on page 2 in the source federal physician minimum data set survey tool. We also provided the US Census categories because we thought perhaps it could be helpful for the council to look across the different types of data collection that are done. And you'll note that white is listed first. And then finally, in the right-hand column of the table, you'll see that there's Indiana's minimum health professions question and response options for race. I'll also call attention to the variable or the demographic identifier for sex. There was a question raised, why is male first? Why isn't it alphabetized? So conversations were had regarding this. And we were able to bring it to numerous individuals within state government. And I think, Doug, you were part of the conversations. Also, thank you so much for carving out time and joining those discussions as well. And then sorry, I failed to mention, but the other indicator that they mentioned was regarding ethnicity. And there were just brought up opportunities to enhance the ethnicity question by adding or modifying the word Latino to represent both gender formats of Latino. So Latino and Latina. So the Behavioral Health Workforce Data Advisory Group brought these forward. And the recommendations that are on page 3 of that document are fairly straightforward and simple. The recommendations that the Behavioral Health Workforce Data Advisory Group had requested that we present to the Governor's Health Workforce Council is reordering the response options for the sex supplemental question field, and then also reordering and alphabetizing the response options for the race supplemental field. And then finally, for the ethnicity question, they recommended adding a hash mark into the Latino, Latina, and having it represent both the masculine and the feminine form of that. So I am going to pause and open it up for council members to discuss. The bottom line recommendations are alphabetization of the sex options, alphabetization of the race options, and the addition of the slash with the A and the O to represent both the masculine and the feminine of the term Latino, Latina.
Dr. Maxey, just a quick question, just a point of clarification. So when the survey goes out and we're collecting the data, those notes that we put on here, like the note response options for the question have been alphabetized, that's just for us to review here. That's not on the official form. I wanted to make that clarification.
Yes, thank you very much for making that clarification. So this is for your review and consideration only. The actual technical only modifications would be the reorder of the sex options and the race options, and then the addition of the slash with the option of the Latino, Latina. So the addition of the A and the O as options for an individual identifying their ethnicity.
I think we probably need a motion to approve this if I don't hear any questions coming up right now.
Fred, this is Ed Charbonneau. I move that we approve these changes.
Okay. We got a second?
I'll second. This is Kara Veal.
Okay, so we have a motion and we have it seconded. All in favor of the modifications as presented, say aye.
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 All opposed, nay. The ayes have it, so we have the motion to approve the modification as is moving forward. Turn it back to you, Hannah.
Thank you very much, Commissioner Payne, and thank you, council members, for your consideration of this. Excellent. So the next item on the in our order of business is regarding the physician supplemental information field. So we just discussed the demographic questions that are included on behavioral health, and they are asked of all licensed health professionals. So those modifications to the demographic questions will be applied across Indiana's data collection initiatives and hopefully support our diversity, equity, and inclusion initiatives for health workforce data as a state. What we will be discussing now is the physician supplemental questions or information fields. Physicians and registered nurses will be renewing their license in the latter half of this coming year. And so therefore, the PLA's timeline is thus that we have to finalize any recommendations or modifications to that tool during this meeting. The council was presented with the tools in the last meeting, and you should have received the survey tool with some comments in it for you to consider, but we are going to talk through those again today. So I would encourage you, if you do have the document, the PDF document of the survey questions, to please feel free to go ahead and open that document up. I will share screen. We are going to go through several questions where feedback or modifications are proposed or required to align with legislation that is passed or recommendations or modifications that have come up from other sources. So give me just a moment and I will share the survey tool so that we can look at those together. Wonderful. Can you all see my screen? I'm sorry. Juggling multiple screens and windows can be challenging. Thank you so much. The first topic that we are going to look at today, the first question on the agenda, besides the demographic questions, which will be updated based on the vote that just occurred, so those are questions 2 and 3, is question number 7 on the physician supplemental survey tool. This does require discussion. However, what is proposed is modification of question 7, which asks physicians regarding their participation in telehealth as a mode for delivering healthcare services to the residents of Indiana. You'll note that the modification is just a language change to align with Senate Enrolled Act 3 from this last session, which modified the definition for telehealth in the state of Indiana. So I'm happy to open it up for any questions. The bottom line is it just modifies the language and the definition to reflect our new definition in statute for the state of Indiana regarding telehealth. I'll take any questions or pause for anyone to ask any questions or provide comments.
Now, I think we may need to have a vote to approve this if there are no questions or comments at this point. Can I have a motion from anyone?
Ken Sauer, so moved.
Second, anyone?
Andy Van Zee, second.
So we have a motion to approve the physician supplemental questions. All in favor say aye.
Aye.
All
Aye.
opposed, nay. The ayes have it, so the motion is approved.
Thank you so much. There were a couple other opportunities for council members to provide input or feedback on the physician supplemental survey tool. One of them is regarding question number 8. Question number 8 is asking licensees and licensed physicians to indicate whether they provide any of the following services. And so you'll note I have shared on the screen, if you're following along on the screen, or if you're looking at the document, we're on question 8 of the supplemental survey tool for physicians. This initial list of services was generated and approved by the council back in 2019. As part of our work with the state, we wanted to ensure that there were whether there were any additional services or modifications that would be helpful or useful for the state to be able to track or identify are being delivered by licensees in the state of Indiana. So I'll take a moment and let you look through the list. If anyone has thoughts, comments, feedback, or input on the services list or services that are missing from this list, please feel free to chime in. Excellent. Hearing none, I am happy to move on and share some additional input and feedback that the Bowen Center received. You'll recall that I indicated that the Bowen Center, as part of our technical assistance to the state of Indiana and health workforce data collection, we convene stakeholders and subject matter experts to ensure that the data that are collected are appropriate and meet the needs of the state from their respective perspectives. So the next item up was feedback that was received from the Indiana State Medical Association. And if you're following along on the PDF document that you received, you can scroll to question 35. Question 35 is a new proposed question regarding employment plans. The Indiana State Medical Association has provided input and feedback and reached out stating that it may be helpful for the state to be able to inform pipeline initiatives related to physicians to be monitoring and tracking the employment plans of our physicians within the state of Indiana. Employment plan questions are asked of other license types of professionals within their supplemental survey tools. So this is a question or a type of question that is asked of other health professions, namely our registered nurse licensees in the state, and used as an indicator of labor market projections to support labor market projections, and also inform, of course, pipeline planning initiatives. I would like to go ahead and open it up. The question on the table here is whether or not it would be appropriate to add one additional question onto the physician license renewal supplemental survey tool regarding their employment plans. So I'm going to open that up, and then I would actually ask, in addition, what time frame the council might recommend that the state consider. So for some professions, a time frame of 1 year might be appropriate. For others, your employment plans for 2 years, and then for others, 5 years. You'll notice in the document you received, there are comments that are embedded with some research that our team did into how other states ask this question on their supplemental surveys. Specifically, Wisconsin asks it for a 2-year period of time. So Wisconsin asks physicians, what are your employment plans for the next 2 years? But the state of Florida asks, what are your employment plans for the next 5 years for physicians? So I'm going to take a pause and open it up to council members for discussion and consideration.
This is more just a comment than anything else when we're talking about our plans for the future.
Mm-hmm.
Most of us think of our plans in more realistic terms in 2 and 3 years. When we say 5 years, we know what we want to do in 5 years, but is that the most realistic number that we can give? That's just a comment on my part.
Hi, this is Brad Barrett. Can everybody hear me?
Yes.
So I'm a member of ISMA, and so I thought it was appropriate that I chime in. And I think the 2-year time frame is great. I think it kind of gives you an idea whether in advance you can plan for a mass retirement or a significant change. So I think it's information that's potentially useful, and I like the 2-year interval.
Thank you very much, Representative Barrett. Sorry. Ms. Veal, I see that you had a comment in the chat. I sincerely apologize. If I moved past the previous question too quickly, would you like to go ahead and provide any input or feedback on question number 8?
Yeah, just going back to that list, and I'm sorry, I couldn't get the mute button off, and then I couldn't type fast enough, so I missed my opportunity, so I apologize. Just one question that I didn't see on there, and I just wondered if it might be something pertinent to include, was questions about screening for suicide.
Thank you for bringing that up. So suicide was not listed as a service. There are not specific questions for types of services generally. Do you have, and perhaps this is something that could be considered, moving forward, because I'm not certain whether that would require a whole new question be considered, or whether there would be a certain service that would be associated with providing care or support to individuals that are at risk for suicide.
Sure, that makes sense. It could just be mental health in general, but.
I apologize. I'm working at home and my dog is barking, so you may hear that. Thank you for that, Ms. Veal. What I would suggest is that I think that's an important subject for the council to consider. I think that it may require additional consideration beyond just today on how that could be incorporated. And perhaps that's something that we could take back and could be considered as we move through the next biennium. And as the council would look at the next services questions that are included on upcoming professions. Does that sound acceptable to you?
Absolutely, and happy to be part of that discussion.
Thank you very much. Is there any other input or feedback on either question 8 or regarding, let me scroll down, or regarding proposed question 35 regarding employment plans? Is there any additional discussion or comments that any council members have before we would take the final tool to a vote? Excellent.
Well, Hannah, I'm going to have to apologize because I should have taken a vote at the end. So now we're taking 2 votes instead of 1. So my use of time has not been efficient. So I'm going to ask if there's a motion to approve this last question, question number 35 as written here in the packet.
This is Brad Barrett, motion to approve.
We have a second.
Ed Charbon will second.
So we have a motion and a second. All in favor, say aye.
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 All opposed, nay. The ayes have it. So we have the addition of question number 35.
Thank you very much for your consideration.
Now we'll move forward on, I'm going to turn it over to Hannah here in a second to talk a little bit about some of the initiatives. And maybe before then, maybe talk about the, some of the dashboards and some of the Tableau information. But there's been a lot of good work done over the past 5 years, and I'm excited about what we're going to see next with what Hannah's going to show. So I'll turn it back over to her.
Thank you so much, Commissioner Payne. We are going to go over now some additional updates on health workforce initiatives, and then I am delighted to share with you high-level summary of the report that you should have received, the draft report that you should have received. That is a 5-year summary of the initiatives, actions, and work of the Governor's Health Workforce Council. Before we dive into that, our team wanted to provide council members with a first look at the health workforce data visualizations that our team is preparing for the state of Indiana. And I'm actually going to walk you through some of them live so that you can see how individuals and stakeholders and constituents will be able to work with and interact with the health workforce data that the council is discussing and approving the supplemental surveys of. So what you are looking at is the beta version. We will be going live with these later this fall of the new physician data dashboards or data visualizations that will be available for the state of Indiana, for individuals and stakeholders and state government folks to be able to interact with state level health workforce data collected as part of the supplemental survey tools. The initial rollout of these dashboards will be with the physician data. And of course, it will include up to 2019 because physicians will be renewing again in 2021. So their 2021 data will go live on the dashboard in 2022. But we did want to give you a first look and show you what the dashboards will look like and how they will be available and accessible and make information accessible to the public and other individuals. So for those of you that were familiar with the previous data visualizations that were available, there was some limited mapping capability to look at the workforce or, for example, physicians across the geography and across Indiana's counties, but there was limited capacity for the data to be customized. Our team has been working on developing and using a new platform, the Tableau platform. I'm sure some of you are familiar with that, and developing capacity for individuals to customize the data in ways that previously were not available. So I'm just going to very quickly show you, there will be several, what we're calling storyboards or several themes where individuals or users will be able to access and manipulate the data. A supply theme, that's what you're looking at now, will present a map of the state of Indiana that is active and shows data on the left-hand side. And then also what we're calling a dot chart that enables users to look at the population to physician ratio by whether the community is located in an urban or a more rural area. What I think is most innovative and we're excited to make available to the state of Indiana is the ability to customize these data visualizations down to for physicians, medical specialty. So very quickly, I'll just show you what that might look like. Practice type is a variable that was developed to identify whether the physicians are classified under primary care specialties and psychiatry for mental health. Those are in alignment with federal workforce shortage designations. You may have heard the term HPSAs before. Those practice types qualify for HPSAs and therefore were broken out separately. But users will be able to actually engage with the data to a level they've never been able to do before. So I just made a selection to look at psychiatry in the state of Indiana. Users will further be able to whittle that down to look at the specific medical specialties that fall within that practice type. So if you'll bear with me, I'm doing this on the test server right now, but I did want to show you what is forthcoming. So what you're looking at now is the map of the state of Indiana, where we look at the population to provider ratio of child psychiatrists within our state. This level of information was not previously available and accessible for users to be able to look at and manipulate themselves. There will be functionality for individuals to export maps and other data visualizations and graphics from these dashboards. There are also dashboards for demographic characteristics. So we just discussed the demographic variables, and the council voted on modifications in alignment with enhancing inclusivity and inclusion of those initiatives. Those data will be available and are available on the dashboard for demographics, as is information broken out not just by race and gender, but by age group as well. And again, these are all customizable by practice type and medical specialty. So opening up the information in aggregate format to be as useful as possible to the state and to stakeholders. The education dashboard is also will be the same customizable features by practice type and medical specialty, and also by renewal year, so users can look at how data have changed across the years the data have been collected. This dashboard is looking at where physicians reported completing their medical degree and where physicians reported completing residency. The visualization shows Indiana and the contiguous states, and then a pop-out shows how the data stack up for other states outside of Indiana and contiguous or other countries. So those would be our foreign trained physicians in the state of Indiana. Again, not to take too much time, but this will all be customizable. So you will be able to select, for example, primary care specialties, and data visualizations will be modified and the data will change in order for the customization of the different features. The last one that I'd like to share with you is regarding practice specialty and practice type. So we just had a discussion about the services list, and that list was developed and voted on and approved by the council in 2019, preceding the last physician renewal period. The reported services in aggregate will be available for individuals to customize and look at what type of physicians are providing which services. So just to do an example, if we wanted to look at physicians that reported providing medication-assisted treatment, buprenorphine, we are able to do that. And the visualization modifies, and you can see you're able to look at how many physicians by specialty self-report that they are engaged in providing medication-assisted treatment, and specifically buprenorphine to any population of need. The population category, of course, is customizable, and it matches the response options on the physician licensure survey. So individuals are further able to customize the data to specific populations. And again, they are able to customize the data based on practice type and medical specialty as well. So if we're looking at primary care, and for example, if we are interested in our obstetric and gynecologists that are involved in medication-assisted treatment, we can see that number, or we can see the total overall number here for primary care as well. So just a few visualizations that I wanted to share with you all. And actually, I am going to share one last thing with you because someone brought up whether or not, like, how does the renewals online stack up? Thank you for that question. I believe it was Dr. Sauer. So the longitudinal trends figure on the new dashboards will show by profession what Indiana's health workforce data has looked like across the years. And so this visualization is just showing our total license count for physicians from year 15, 17, and 19. So the preceding 3 biennia renewal periods for physicians. And then showing how many responded to the surveys in each of those periods. In response to the question that you raised, or I think it was Dr. Sauer, that he raised about how many licensees do not complete the online renewal process, because the questions are now embedded into the renewal process, and because Senate Enrolled Act 223 authorized the PLA to collect these data, and it is required of online licensees, the difference between the online and the paper-based renewals is the number that you're looking at here. So sorry. I don't want to take any more time. I'm happy to answer any questions that anyone may have regarding the dashboards. We're very much looking forward to launching them and making the data accessible and available to council members and stakeholders and constituents statewide.
Hey, Hannah, this is Ed Charbonneau. Can you go back to the map?
Yep.
And how do you see that playing out? You know, I noticed, think it was Newton County, or there's 2 of them over there on the far west side by Illinois that are pretty, I gather that means they're need some doctors.
Yep.
How do you see this map being used?
So I see this map being used by individuals that would like to have the best information available on what the workforce looks like across our state in different communities. And not just seeing that Newton has a low number of providers, for example, but also the ability to say, you know, where do we have family medicine physicians? So just the example that I was giving earlier, we want to look at our overall physician workforce capacity, but it's also important for us to potentially, if we're targeting certain health initiatives, to be able to identify and look at certain categories of physicians. So for example, I would envision someone that would be interested in assessing our primary care physician capacity. They may want to produce a customized visualization where they would look at the distribution of primary care specialists, and even further, let's say they're interested in family medicine physicians. They would want to look at and produce the most recent map to look at our distribution of family physicians to say which counties are doing good and which counties do we need to focus on. So this is just an example of that. And then I would tell you, Senator Charbonneau, in addition to just having the map available to show where we have gaps and potentially need more providers, the visualization on the right-hand side helps us to understand where some of these counties fall in relation to federal benchmarks. So for primary care, for example, if we're interested in enhancing or ensuring that there is sufficient access to primary care providers or primary care physicians, the federal government has a recommended benchmark for the population to primary care physician ratio. And you'll see that on this right-hand figure, that primary care benchmark is indicated by this hashed line. And so a user would be able to go through and see which counties are below the, their population to provider ratio is below the recommended number, meaning that they have enough primary care physicians for their population. Anywhere that you see that there are more than 3,500 people per one primary care doc is an area that the federal government would consider a shortage. So these are ways that the state or advocates or General Assembly members such as yourself, if you have questions about whether areas have need or what the workforce looks like, now it is going to be easily customizable for you.
Thank you.
Hannah, this is Chris Box. I would also say this is going to be incredibly helpful as we look at student loan repayment programs where we can help to fill the need for certain specialists in certain areas of the state. This will really give us good data and information with regards to that support.
Thank you so much for that, Dr. Box. I agree. And because this data now goes beyond just primary care and psychiatry or mental health, because we do have primary care health professional shortage designations, we do have mental health shortage designations. These data will help us to know where we have potentially gaps or shortages of other types of physicians so that we can really hone in on the types of pipeline initiatives or graduate medical education initiatives or various things that the state could focus on to ensure access to certain types of services and support loan repayment programs or various other things. So are there any other questions or comments regarding the forthcoming visualizations?
Hannah, the other thing I wanted to mention, this is Chris again. Did you guys select out for those individuals that are still actively practicing? You know, we ran into that a lot with licensures that people keep in place, but they're not actively working.
Mm-hmm. Thank you for asking that. So the figure that I have up on the screen now, what you're looking at, this data is basically just showing what workforce data has looked like across the years. The top bar is total licenses, as I suggested before. The blue represents survey respondents. So until the most recent renewal period, physicians could elect to respond to supplemental questions or they could just decline them. Beginning in 2019, if you renewed your license online, you had to respond. So the blue indicates all of the survey respondents. And then the green is the report sample. And perhaps we need to change that language. These are the physicians that responded to the license renewal survey and indicated they provide direct patient care to residents in the state of Indiana. So we are 100% confident in the green bar being our workforce capacity. The dashboards for direct patient care are built upon the green bar. So that is our direct patient care capacity. And because the survey questions are required and there is attestation that the information is correct, we are very confident that this is our workforce capacity with very minimal additional potential capacity of the individuals who renew their license manually through paper.
Thank you, Hannah, for clarifying that. I'm sorry if I missed that before.
No, I failed to say it. So thank you for bringing it up.
Hannah, Ken Sauer, question about nursing and nurse practitioner specializations. Would they be represented then as well in this data visualization?
So they will be, they're second in line. Registered nursing, which includes in the state of Indiana, our advanced practice registered nurses, because we do not have a separate dedicated license for our advanced practice registered nurses. Other than a controlled substance license, which is optional for individuals to hold. Their dashboards will be next. And so we can expect that the nursing dashboards will be rolling out in the winter of, over the winter of 2021 to 2022. We're building them out by profession, but yes, all of that data will be available, and you will be able to look at the advanced practice registered nurse and the specialists of our APRNs. They will be very similar and have the same functionality as the physician dashboards, but they will be customized to nursing.
That's terrific, Hannah. Thank you.
Thank you. Thank you, Commissioner Payne, for providing me time to share a first look of the dashboards with council members. We're very excited to be launching those. I think you're on mute, Commissioner Payne.
Oh, can you hear me now? I guess you didn't hear any of that I just said. No, I just said thank you so much for sharing that that rich information, and was kind of excited to see the Tableau and see the dashboard and how it's all come together. Now we'll move on to the council initiatives, Hannah. So excited to hear about this reflection over the past 5 years.
Thank you so much. I apologize that you just received the draft 5-year council review yesterday. We did not expect that you would have already had time to review it. In fact, today what I'm hoping to do is just give you a primer to the document and provide and go through some highlights that perhaps the council members can discuss or look back on that were contributions of the council or initiatives of the council over the last 5 years. Commissioner Payne did ask for the Bowen Center to produce a report that looked back across the 5 years in order to prepare the council for discussions regarding what the next 5 years and beyond should look like for the Governor's Health Workforce Council. So the document you received is just a summary that overviews and highlights the work of the council and indirect or direct outcomes or contributions of the council across the state of Indiana and health workforce initiatives. As you go through the document, and please don't feel as though you need to go through it in extent today, we are welcoming any feedback that any council members may have on the document prior to finalization. But today is more to kind of present the highlights to you, and then perhaps you could take a look at the document or have someone on your team take a look at the document at a later date and provide feedback and input. In the document, it overviews the structure of the council. And so we created an infographic that highlights the perspectives that are currently represented on the council, and specifically also shows the relationship of the Bowen Center, that is my center at Indiana University, and how it supports and works with the council on various types of initiatives. Within the 5-year review, you will note that we've structured it to have a timeline of activities. Since this is a 5-year review, we thought it would be helpful to track over the last 5 years the work of the council and any initiatives of the council, and then also to be able to tie in any outcomes that the council work contributed to. So you'll notice as you go through the document that there's an infographic that tracks every council meeting, every subcommittee or task force meeting that was convened, and then the duration of any of those as well. So over the past 5 years, there have been 6 initiatives that the council has convened on or made significant contributions to. And I'm actually going to go through highlights of each one and talk through what the contributions or either direct or indirect have been from those. You'll also notice that, and I'm sorry, this is very messy. However, we just wanted to get you a snapshot of what is in the report. Also an overview of the outcomes. So the previous page was an overview of the different meetings in the timeline. And this slide is just showing how the overview of the meetings tied to the outcomes are presented. So this is just an infographic to show you. And I think it's important to note that there are a lot of contributions that have occurred that the council has either directly or indirectly contributed to important work across health workforce initiatives. So we're going to just kind of touch on those today. One of the early initiatives of the council was the Education Pipeline and Training Task Force. For those of you that have been on the council for the past 5 years and may have been a part of or involved in the discussions, some of the contributions of that task force and the recommendations that were generated out of it was the development of a bridge program for certified nurse aides at Ivy Tech. So the Education Pipeline and Training Task Force, they were considering individual occupations and the opportunity to identify and highlight potential career pathways. And one of those was regarding CNA. The information that was generated by the task force and prepared by our team went into a report that has been widely disseminated at this point, both in the state of Indiana and nationally and within other states, contributed to conversations and work at Ivy Tech to establish a bridge program that offers credit to individuals that are CNAs for their prior training and work experience as a CNA towards practical nursing or their ASN Associate of Nursing degree. So one outcome associated with the Education Pipeline and Training Task Force. The other, and I would encourage Dr. Sauer to chime in, is regarding Occupational Explorer. So the Education Pipeline and Training Task Force also engaged in conversations regarding the importance of having information available to Hoosiers to inform their pursuit of education and training and their pursuit of different careers and occupations. Some of the conversations out of the Education Pipeline and Training Task Force were used by the Commission on Higher Education to inform initiatives, ongoing initiatives with Credential Engine. And I don't know, Dr. Sauer, if you'd like to speak anything about Credential Engine or the way in which conversations or synergies through the council may have contributed to the work of that.
Yeah, right. Well, thank you, Hannah. And indeed, the Indiana Credential Registry, which is the database for Indiana that is a subset of the Credential Engine database, has been greatly informed by the work of the council. We've published a lot of data on health-related programs, including, for example, the pass rates on nursing, the NCLEX exams, both the RN and LPN for public institutions. And we're in the process of linking all of that data to the Career Explorer software that the Department of Workforce Development licenses. And I have to compliment the DWD and the work of Beth Megashar and Pam Warner in involving the commission and other agencies besides DWD in that work. So the idea in essence is to, as Hoosiers of all ages explore their career pathways, when they get to the point of saying, okay, this is what I'm interested in, how do I get there? What kind of education and training do I need in order to accomplish my career goals? That's where the Indiana Credential Registry, the Credential Engine work comes into play. And so anyway, this the activities of the council have greatly informed that work, and I'm sure will do so in the future as we continue to publish more and more data about health-related education and training programs.
Thank you so much for those comments, Dr. Sauer, and thank you for the opportunity to contribute to those initiatives. Next up is the Mental and Behavioral Health Workforce Task Force. Also a task force that was convened early on by the Governor's Health Workforce Council. And all of the information in the report is also available online through the Department of Workforce Development web pages for the Governor's Health Workforce Council. We've taken it and summarized it and synthesized it into the 5-year review document. So what you're looking at today, all of the background information was pulled directly from council documentation, meetings, reports, presentations, etc. So for the Mental and Behavioral Health Workforce Task Force, just several highlights that were informed by the work of the council or the council contributed to. The first around continuing education for opioid prescribers. The council was reviewing health professions' competencies for behavioral health and substance use disorders that would support integration and collaborative care models. And in consideration of those competencies and a way to enhance those competencies, continuing education was identified as a strategic priority. In 2018, subsequent to conversations and the work of the task force, Indiana Senate Enrolled Act 225, 2018 was passed, which established a 2-hour of continuing education requirement for licensed health practitioners who apply for the Controlled Substance Registry, specific continuing education for regarding opioid prescribing. And so delighted that the conversations could contribute in a meaningful way to ensuring that practitioners and prescribers have the information that they need. The second topic that the task force, the Mental and Behavioral Health Task Force, considered and discussed in extent was expansion of telehealth and reimbursement for telehealth services. And specifically, they explored and made recommendations for leveraging telehealth and behavioral health services. I think it's important to note that at the time that this task force convened, the only certain prescribers were permitted to provide telehealth services. Only prescribers were permitted to provide telehealth services under our state statute. And there was an initial face-to-face meeting. Of course, we know telehealth has changed drastically since that time, but the task force conversations did have opportunities to inform initiatives at that time. Specifically, there was legislation in 2017 which permitted and supported Medicaid reimbursement for telehealth services. Also, in 2019, there was a bill that was passed and statute that implemented psychologists to practice telepsychology. And then finally, of course, most recently, we've expanded the telehealth provisions and that the professions that can support telehealth delivery. And we're just excited and delighted to see advancements in telehealth in our state. So just some of the synergies and contributions. The next is the Community Health Worker Work Group, which was tasked with assessing community health worker expansion and formalization as a state. This work group convened actually at the request of Dr. Adams, who was the state health commissioner at the time. And he indicated that there was work being done to formalize community health workers and to obtain reimbursement for community health worker services that were provided, and identify the opportunity for cross-government discussions and external collaboration regarding how a community health worker could be defined and formalized for the state of Indiana. That work group convened and discussed and considered various definitions for community health worker, and also discussed the various types of training or types of credentialing or registration that might be appropriate for the state. A recommendation out of that work group was a formal definition that was adopted by the council, it was adopted by the Indiana Department of Health, and then subsequently adopted by the Indiana Office of Medicaid Planning and Policy, and is in alignment with the current reimbursement that we have through Medicaid. Another opportunity where the council discussions early on contributed to synergies and informing just ongoing work across the state of Indiana. The community health worker work group had representation, strong representation from the Department of Workforce Development, and conversations there regarding expansion of community health workers were able to support and inform and kind of reinvigorate conversations and be used in conversations regarding ways to create opportunities to expand community health workers and also to provide opportunities for employment for individuals with mental health and substance use disorders. And the Department of Workforce Development specifically obtained funding from the Department of Labor for community health worker workforce development initiatives. The Department of Workforce Development individual, Judy Hasselkiss, who co-chaired the community health worker work group, was pivotal to helping to support the work to obtain that grant through the Department of Workforce Development. So just another opportunity where conversations and work of the council informed initiatives across state government. Regarding state loan repayment, the council convened a state loan repayment program several years ago. That group was tasked with considering state loan repayment, the state of state loan repayment programs in the state of Indiana, and identifying and assessing opportunities for enhancing loan repayment programs across the state. As part of the work of that work group, the Bowen Center provided support for a 50-state review of state loan repayment programs that are implemented across different states. Those ranged from loan repayment programs that are accomplished in partnership with the federal government. So that would be the National Health Service Corps State Loan Repayment Program, which Indiana now participates in. And it also reviewed state sovereign programs. So programs where states made additional investments that were targeted in order to produce or provide incentives to get the right types of healthcare professionals and workers into the communities where they were needed. That 50-state review was used by the state loan repayment program for discussions and considerations. And then in addition, that work group also contributed to an evaluation of the loan repayment assistance program that had been developed and administered by the Division of Mental Health and Addiction at Indiana Family and Social Services Administration. And that evaluation identified opportunities, what worked in our state loan repayment program for mental health and addiction professionals, and where were opportunities for growth or targeting in the state of Indiana. Subsequent to the work of the state loan repayment program, Indiana submitted and was successfully awarded matching funds for a National Health Service Corps State Loan Repayment Award in 2018. The sum of that is $300,000. I think it's still ongoing through implementation for loan repayment, and that was matched by our state. So the total funds that were available to the state to operate that program were $600,000, and it is ongoing initiative at the Department of Health out of the Office of Primary Care. And then more recently, the Occupational Licensing Policy Learning Consortia. The council took the lead and identified several individual council members to serve as a core team that participated in this learning consortia regarding occupational licensing for a 2-year period in time. There were, I think, 13 states that engaged in the opportunity. And there have been numerous outcomes associated with Indiana's participation. Just a few I have listed here. One regarding addressing occupational licensing barriers for special populations and specifically individuals with criminal histories. One of the outcomes or contributions that the council made was regarding the need for enhanced transparency in relation to disqualifying crimes for an occupation. So, for example, if an individual was in a education and training program where the primary outcome would be a degree that would prepare them for a licensed occupation. However, if they possess some type of criminal history that was a disqualifying history for a license, there was no transparency around those disqualifying crimes that disqualified individuals for specific type of licenses or credentials. And there was legislation passed to ensure that that transparency existed moving forward. So individuals that were interested in or pursuing certain licensed occupations were aware of any disqualifying crimes and could make their occupational decisions accordingly. So that's just one of the outcomes. The other, which I know the council has heard on more recently, is regarding licensure compacts. Indiana has implemented the Nurse Licensure Compact and has had legislation regarding numerous other compacts that have been considered by our General Assembly. And in addition, the council convened the Licensure Compacts Learning Lab in 2018, and then also has developed through the work of the Bowen Center several briefs that highlight and look at the differences in each of the compacts for purposes of learning and information sharing across the state on what those compacts are. I have one more slide, and then I'm going to hand it back over to you, Commissioner Payne. And this is just regarding COVID, because as you look at the report, you'll notice that the work of the council shifted, and much of the work was focused on COVID-19 state support. The Bowen Center typically provides the expert support to the council for all of these work groups and different initiatives, and provides ad hoc assistance and support for any related initiatives for state government agencies requesting that through our contract and through our partnership with the state. Over the last, 17 months, much of that work was focused on supporting COVID-19 response. And so this is just a graphic in our forthcoming Indiana COVID-19 Health Workforce Report. It's looking at basically the healthcare workforce response in the state of Indiana, and contributions of our healthcare reservists and the organizations that submitted requests. So this is going to be a report that's forthcoming. And just will provide information on what strategies were implemented, how many individuals stepped forward to serve, how those individuals were matched to facilities, and so on and so forth. So we were honored to be able to pivot to provide that type of support to the state. I'm going to hand it back over to you, Commissioner Payne.
Thanks, Hannah, for sharing that information. And that was sort of a look back on what's been done. A lot has been accomplished in really a short amount of time. But I guess when you've gone back through the past 15 months, 5 years it's all relative. With that look back, I know it's now kind of time to look forward and see what's next on our horizon. So, yes.
Can I say one thing? This is Chris Box. I'm sorry to interrupt you.
Yeah, go right ahead.
I just want to say that Hannah and her team have been extraordinary partners and collaborators throughout this pandemic. And we could not have met the workforce needs for the state of Indiana without the assistance that we got from this team. So I think everyone really needs to know how hard they worked, how quickly they took things over, just the ability when we had, whether it was local health departments, hospitals, or long-term care facilities reaching out in desperate need of assistance for workforce. Hannah and her team so many times connected with those specific institutions and met those needs with actual providers' names and contact information. So thank you from the bottom of my heart for all of that work.
Thank you so much, Dr. Box. Our team was honored to be able to be a part of the response and help serve our state.
Yeah, and I second that. And I think anyone who has really engaged with Hannah and the team at Bowen, they know that they're anxious to get the job done and get the work done and really try to make sure that they have all of the stakeholders necessary engaged in the process. So I appreciate that as well. Which means that in the future, I know you're going to be reaching out to other stakeholders to make sure that we have as much inclusive information as possible. And so in looking forward over the next 6 months, if we could, kind of like for the council to engage in a strategic planning process to develop some recommendations for the council moving forward. And the process is going to include a few things. Identifying and engaging key stakeholders, of course. That could include not just council members, but hopefully other perspectives that would provide some insight on this work. And so that's where we would lean on some of the council members to really let us know, to talk about what other perspectives we need to bring into the conversation. And then developing a consensus on recommendations for the sustainability and health of the workforce data and policy coordination activities. And other contributions. So if we could really think about that and really move forward with that over the next 6 months, I think that puts us in a good position to really think about what's going to happen over the next few years in terms of this space. We have there's a lot of work that's been done, a lot of great work that's been done, and there's a lot of work yet to do. But if we do it in a coordinated fashion like that's been done in the past 5 years, I think we'll be, further ahead than many other states. So I'd like to kind of open it up for discussion right now to talk a little bit about any strategic planning for the next 5 years and really hear your thoughts or any comments on that.
Well, this is Chris Box again. I will speak up. A couple of things. One thing that we have needed very much as we've been working with American state and territorial health officers and the CDC with regards to substance use disorder in our pregnant moms and our newborns is having a handle on providers across the state that do substance use disorder treatment and prescribing for our pregnant women. A lot of people do it, but they don't do it for pregnant women. So the ability to be able to now connect the data that you're going to have, Hannah, and make sure that that's available on the websites that we use for our providers that do substance use disorder and pregnancy, or our OB providers that are looking for someone that is willing to partner in their community with them to provide this, or even remotely by a telemedicine thing, is going to be really important. And I think also connecting like my chronic disease division with you guys, so that as we look at our foreign medical grads in the past, we have always kind of gonna first come, first serve. It's kind of a game to see who can get the application in first for those, first X number of applications that we can approve and allow them to stay here in the United States. I would like to do that more on a need basis going forward by looking at the actual workforce that we have with that particular, subspecialty or group. So I can see a lot of applications for this. And I think it's a question that all of us need to think about how we can integrate this data and use it with the programming and the divisions that we already have and how they might need it.
Dr. Box, I appreciate you bringing that up. I wanted to let you know that on the dashboards, your team will be able to look at any physician that reported providing medication-assisted treatment, buprenorphine, to pregnant women. So that's going to be readily available when we launch. So that we were hoping that that type of information would be useful. So.
Thanks. Any other comments about this section, about our strategic planning and anything even associated to it that we can make sure that we're having as good a picture as we can as we move forward?
Well, go ahead.
The only other thing I was going to say is that as I look at my regulatory division and realize this conversion or change that we may be seeing and fostering as we go forward to aging in place and long-term care facilities, maybe not caring for as many of our individuals at home, I see our home health care division growing and needing continued support. And how do we grow that workforce, train that workforce, and specifically give them potentially certifications and certain things like Alzheimer's or diabetes or other things to make sure that they are, just like in our long-term care facilities, kind of prepared to manage the patients they're going to be dealing with in a home setting.
Thanks.
I'll just add a comment on credential transparency. And by the way, I wanted to acknowledge Hannah and Courtney's work on that as well. They've been really, really helpful as we've tried to publish data on health related education and training programs. I mentioned that we have published the pass rates for the public schools of nursing. We've done that because at the commission, we have more statutory authority over the public institutions and said, you've really got to do this. We don't have the same kind of authority with respect to the private, nonprofit, and private for-profit schools. So, for example, if a student is looking at a nursing, if you're comparing some nursing programs, you'll get a lot of information on nursing programs that are offered in the public sector. You don't get the same kind of information with the private, for-profit, and nonprofit programs. So one of the things that the council might consider is the extent to which a school that prepares people for a licensed profession, such as nursing, needs to be on the registry so that the pass rates on that licensing exam could be available to students as they compare programs on a variety of factors, costs, return on investment, and so on, but also on that pass rate so they can take that into consideration as they choose which school to pursue.
Thanks for that, Dr. Sauer.
I would suggest one opportunity that I'm aware of that other states are also looking at. We have, with the exception of community health worker, the council has done fabulous work looking at our high skills occupations and highly trained occupations that touch higher ed programming, obviously critical to the workforce. Dr. Box brought up a great point though, right? Our entry level workforce that may not touch higher ed, that goes through career and technical training or employer-based training, they're in demand, and there's going to be increased demand there. So I would like to see the council consider opportunities to examine ways to enhance and streamline those more entry level and middle skills occupations, and consider maybe partnering with work-based training opportunities. I know we have that, but perhaps there are even better ways for us as a state to consider that, and not just consider the work-based training or apprenticeship opportunities, but how are we building in strategic pathway opportunities? And of course, since we're a health workforce council, I would say strategic pathways for sector retention, okay? In healthcare, obviously we wanna have those pathways so that individuals can achieve their goals in various different sectors that they'd like to be in. But definitely I see that as a strategic opportunity and area of growth for the council.
I agree, Hannah. So if there are no other questions or comments about the strategic planning piece, I mean, we always have time to take any additional comments. If you have them, you can forward them over to us. Now I'd like to ask if there's any new business that we need to bring before the council. No new business. So we have our next council meeting coming up on September 23rd at 12 o'clock. Right now it's scheduled to be a virtual meeting. So we look forward to that. And before we adjourn, I want to make sure that, just ask one more time if there are any other comments that anyone would like to make before we adjourn. Okay, it is it's a little bit after 1:30, and I'd like to have a motion to adjourn our meeting.
So moved.
All right.
Second.
All right. Well, I'll take a vote on adjourning this meeting. All in favor of adjourning the meeting now at 1:32 p.m., say aye.
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 All opposed, nay. The ayes have it. Thank you all for your time this afternoon, and thank you, Hannah and team, for putting everything together today.
Thank you.
Yeah, thank you.
All right.
Thank you.